There's two major types of diabetes. There's type 1 diabetes and then there's type 2 diabetes. 1 is the type of diabetes where you have no insulin production. Your body does not have the capability to produce insulin. Those patients are usually born with their diabetes and they require insulin replacement. And then your type 2 diabetics is an insulin resistance. Your body is producing the insulin, but because there is so much sugar and so much insulin that the rest of your body is not even responding to it. And that can happen if we have a lot of weight gain around our middle. Adipose tissue increases insulin resistance. Those patients can take oral medications, and those patients do have the option, if they lose weight and keep their diet under control, to come off their medicine. Have they had weight loss? Are they drinking so much, eating so much, and then peeing so much that they don't feel like they can keep up? Are they having numbness and tingling and burning in their feet and hands? Are they having blurred vision? Do they have carpal tunnel-like symptoms and they don't know that that could also be from diabetes? So those are all symptoms that are concerning for you having issues with blood sugar modulation. The first thing I'm gonna do as a physician, if a patient walks in and tells me these things, is I'm gonna check an A1C. An A1C is a lab test that we get, gives us a 3-month average of your blood sugar. And there are kind of ranges you need to be in: the healthy range, a pre-diabetic range, and then a diabetic range. A1C comes back at something higher than 6.7. 6.7 is diabetes. We need to have a talk about starting medicine. We need to have a talk about diet changes, and we need to have a talk about lifestyle changes. The other big part of the conversation when I tell someone they have diabetes is, what long-term things do I have to worry about? There's a lot of things that can be affected. Your blood vessels will start to put actual sugar on our blood vessel walls, and then our body sees that as injury and tries to heal it. And then when that happens, you get plaque formation, so then you get what we call peripheral vascular disease, which is a condition of inadequate blood flow. The other thing that can happen is chronic kidney disease. The same way that our body will put sugar on blood vessels, it will put it on the functioning parts of our kidneys. And then when that happens, we start spilling protein in our urine from the blood, and that injures the kidney. Another system to be concerned about are your nerves. Our body will put sugar on nerve cells, and then that affects our ability to send a signal from the brain to whatever part of the body we're trying to have control over. So burning and tingling in the fingers and toes is how that starts, and it can get worse and climb. Your diabetes remains uncontrolled the more damage that's done to your nerves. So all of those different conditions, every organ system is affected by something as small as you've got too much sugar in your blood. Your diet is very important. Making sure you're cutting out simple carbohydrates, the white foods, your white rice, your white bread, your full-fat dairy products, so white milk. All of those have simple sugars that increase the production of your insulin and then therefore can fatigue the system. Fats don't mess with your blood sugar. Protein does not mess with your blood sugar. It is carbohydrates and simple sugars that mess with that number. Diet education is core to their long-term survivability with diabetes. This disease process very much depends on your concern and care for your own health. If I had one thing I could tell patients about diabetes, and I think that it would change the outcome and maybe even give them a new perspective on that, is what our diet consists of has a lot of impact on just our whole system. It is as simple and it can be as easy as, I just need to eat better. I just need to move more. That's it. And most of those patients do the best. It does not mean that you will be so sick in the future that you can't take care of yourself, or that you're gonna have to have amputations, or you're gonna end up on dialysis, or you're going to have a heart surgery. Diabetes does not mean those things if you take care of yourself at the very core foundation of what diabetes is, and that is to clean up your diet and be more active.